Insurance issues in the ACA. The thesis is giving descriptive information regarding the ACA program, and using epidemiological data we can show how the target population, age, ethnicity all determine how successful the Affordable Care Act will be in the future. Epidemiology assessments will guide the overall outcome to the healthcare coverage issues. Only after understanding these issues can we offer some assurances how we will ultimately attempt to solve these issues. The vulnerable population of America includes mother, children, and teens, abused individuals, chronically ill and disabled, people diagnosed with HIV and AIDS, people with mental conditions, people affected by alcohol and substance abuse, indigent and homeless individuals, and minority and ethnic groups that involve very young to senior adults. Healthcare disparities differ among these groups due to lack of insurance coverage, accessibility to healthcare, quality of healthcare, the proximity to healthcare, and limited income to pay for medical treatments. These factors indicate that our target range is between the ages of birth to Medicare of all individuals in the United States. As the Affordable Care Act impacts all of these individuals, especially those with medical conditions or special economic or cultural conditions. The United States is the only industrialized nation that doesn't offer healthcare coverage for all of its citizens. Despite repeated attempts to expand healthcare insurance coverage, approximately 46 million Americans lack coverage. Healthcare insurance facilities access to care, preventative care, and helps protect against the high cost of catastrophic illnesses. Due to these needs, the Affordable Care Act was enacted to provide health insurance coverage for Americans who are at a socioeconomic disadvantage and vulnerable population groups who can be found in every state of the United States. A census study taken by the Institute of Medicine confirmed that an estimate of 18,314 Americans between the age of 25 and 64 years old die annually because of the lack of health insurance, comparable to deaths because of diabetes, stroke, or homicide in 2001 among persons aged 25 to 64. There are many social and behavioral determinants that affect those vulnerable groups who lack healthcare benefits. They are policymaking, social factors, health services, individual behavior, economic and biology, and genetics. Social determinants reflect the social factors and physical conditions of the environment in which people are born, live, learn, play, work, and age. These involve the resources to meet daily needs such as education and job opportunities, living wages, or healthful foods. It includes the social norms and attitudes, exposure to crime, violence, and social disorder, social support and social interactions. There is exposure to mass media and emerging technologies, socioeconomic conditions which include poverty, quality schools, transportation, public safety, and residential segregation. These determinants impact a wide range of health, functioning, and quality of life outcomes. Both lack of health services and quality health care is determinant that impact healthcare. Lack of access or limited access greatly impacts an individual's health status. The person who doesn't have health insurance is less likely to participate in preventative care and possibly delay medical treatment. The barriers to accessing health care include the lack of availability, high cost, lack of coverage, and language barriers. These barriers may lead to unmet health needs, delay in receiving appropriate care, inability to get preventative services, and prevention of hospitalization. Individual behavior is also another determinant that affects people who lack health care insurance. Each person plays a role in their health outcome. Each public health and health care interventions focus on changing individual behaviors such as substance abuse, diet, and physical activity. A positive change in individual behavior reduces the rate of chronic diseases in the country. Biology and genetics affect specific populations more than others. It is known that senior adults are biologically prone to being in poor health versus adolescents due to the physical and cognitive effects of aging. There are various ethnic groups who are genetically prone to specific diseases based on inherent ancestry. These biological factors are determined by age, sex, sexual orientation, and family history. Policy making involves policies at the local, state, and federal government level that affect individuals and population health. Some policies affect the entire population over extended periods of time, while simultaneously helping to change individual behavior. The existing policies dealing with the Affordable Care Act are as follows. The main concern was that no discriminatory practices were involved. Public health has always been a major concern, but also the protection against an increase in cost of health care. No discriminatory practices of their party payers, arbitrary discrimination that limits full reimbursement. Starting in September 2010, insurers are no longer to deny coverage to children younger than 19 due to pre-existing conditions. There are policy development ideas set in place and future endeavors, outlines of care that are expected to be followed in accordance with the Affordable Care Act. A primary care practice can use this model to allow patient-centered medical homes or accountable care organizations. Policymakers took note on the potential of guided care models for the ACA of 2010. Medicare and Medicaid centers are tested to ensure successful new payment and service delivery models. With new development, vast improvements were made to quality of patient care, caregiver perceptions, quality, to reduce the use and cost of expensive services in well-managed systems. Two major goals of the Affordable Care Act is to provide the uninsured and underinsured Americans within the country health insurance, and to lower the overall cost of health care. There are a few stakeholders that have personal opinions about the overall policy and the success of the Affordable Care Act. Dr. Brian Klepper is the CEO of the National Coalition on Health, a nonprofit membership organization of purchaser-led healthcare coalition. Dr. Klepper is pleased with the outcome of the law since it has helped many uninsured Americans gain access to health care. However, he says that the policy is somewhat distorted due to the excessive lobbying from the healthcare realm. Dr. Klepper has said that with the ACA, the nation has enhanced coverage by 10% at public expense. This is a good thing because the nation's overall uninsured rates were a disgrace. Dr. Paul Markovich is the president and CEO of Blue Shield of California, a 3.3 million member nonprofit health plan servicing the state's commercial, individual, and government markets. Dr. Markovich explains that the ACA has done what it was enacted to do. Now more than ever, lower and middle socioeconomic classes have access to health care. He also states that on a whole, in order to truly test the progression of the ACA, it has to be done on a state-by-state level. As someone who has supported from the outset the goals of the ACA, I feel good about what the law has accomplished so far, particularly in California. First and foremost, we've seen enormous progress in helping people with modest incomes become covered at an affordable cost. Margaret Murray is Chief Executive Officer of the Association for Community Affiliated Plans, ACAP, which presents 58 nonprofit safety health net plans in 24 states. She is glad to see the progress that the ACA has made. The uninsured rates of the nation are going down while medical insurance premiums have not skyrocketed. We are getting to the point where the facts on the ground are beginning to win out over the political rhetoric. Murray says. Greg Vigdor, JD, is President and Chief Executive Officer of the Arizona Hospital and Healthcare Organization, which serves as an advocate for the issues that impact the quality and accessibility of healthcare in Arizona. In his assessment of the policy, he explains that the policy has done wonders within his state. Just as his colleagues have mentioned, the ACA is doing what it has set out to do, which is granting quality access to healthcare. On another note, Mr. Vigdor does not see how the ACA will sustain itself long term. It is whether the act will trigger real reductions or control in our level of healthcare spending, and if it does, whether these are positive savings related to real improvements in care or just government or private sector price cutting. He goes on to explain that while the Republican Party has assured its voters if they were to win office they would repeal this law, it would indeed be political suicide since millions of Americans are receiving quality health care. These stakeholders were chosen because, political affiliation aside, they were truly unbiased of the law and its purpose, which is to grant health care and to the uninsured and underinsured. They are subject matter experts in their field, and because they run such large healthcare organizations, they are able to see firsthand the pros and cons of the ACA. Policy development is important to the Affordable Care Act because without it there would be absolutely no improvement of the issues that arise. Any policy that is made might not work out as well as the writers of the ACA wanted it to. Due to this, developing the policy is in order. However, there are 3 of the essential services that will help reveal to all the stakeholders how the issues are being fixed. Informing stakeholders that we recognize the issue and we need to tell them how we are going to fix it. Next, we need to educate the stakeholders on the new policy in order to ensure that it is enacted properly. Empowering stakeholders to have a voice to help change our healthcare system for the better is a wise idea, because when people feel as though they have no say in anything, they tend to rebel. And finally, mobilizing community partnerships is vital because of the healthcare organizations are able to get out into the community to assist them. The public will learn about the ACA other than just what the news has told them. The Affordable Care Act has some serious challenges: laws and regulations, website issues, long-term problems with the U.S. economy. With ACA will link people without insurance or inadequate health care, which until now has been a moral issue our country has faced. Enforcing laws and regulations by making sure the ACA expands coverage while slowing costs and increasing efficiency of the healthcare sector. Laws surrounding the ACA enforces policies from covering only people with high healthcare costs. ACA includes penalties for people who go without insurance. Businesses with 50 employees or more who don't offer insurance will be required to pay a penalty. The ACA will provide assurance to those in the community to sustain a level of quality and effective care. This will be obtained by ensuring programs and medications are affordable. An expansion of the funds will allow a person on the HCBS program. The creation of new programs will provide personal assistance services such as community first choice options. Research and new insights involving ACA has many different approaches. Some consider the reform to be a healthcare crisis. Third parties are now paying at least 87% of healthcare costs. Here are a few solutions to the healthcare problems: changing the tax code, eliminating some state mandates, and reforming Medicare and Medicaid. Ultimately, the effectiveness of the ACA has been able to provide to the population has different reviews. Has there been a decline in the employer coverage? Yes. The number of uninsured Americans been addressed so far? Yes. Whether there has been a decrease in out-of-pocket costs? No. So at this point, 2015, some things are working, but also still a work in progress. Many small companies have found it cheaper to take the tax fine for not offering coverage to employees than offering coverage to each employee. As we get further into the implementation of the ACA, it should be possible to make it more appealing to